Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright, Paul, tell me what's going on with your leg, what happened?
For about the last 10 months I've had some pain in my right leg. It jumps between my calf, my thigh, and sometimes around my knee. Been going to a chiropractor for about a week. I almost 10 months a year, and he thinks it's a TFL.
How long have you been seeing the chiropractor?
Year and a half.
Year and a half. And how did you hurt your leg or knee?
Well, you know, I don't remember ever hurting it. I think it was just a kind of a gradual onset, and it just started getting worse and worse. And that's when I was going to the chiropractor anyway, and had him specifically, you know, work on my adjustments based on that right leg as well.
So, any other treatment you had for?
No, other than putting some heat on it and massaging it and using a hot tub, you know, when I can. That's about it.
Can you explain to me how, like, what kind of motion aggravates your symptoms? How much pain from 0 to 10?
Sometimes when I walk, I have a pain. Getting out of bed after a long night's sleep, there's some stiffness. If I sit on a sofa, watch TV, watch a movie, I get up, I'm a little stiff and sore. Like I said, I can go down to the gym and I can get on a elliptical trainer, I can get on a rotary bike, and I can go 2-3 miles on each one of them, no pain, nothing. Then, you know, an hour or so later, you know, it starts to egg, yeah.
So the motion that aggravated, is it like bending, stairs?
It's the bending and flexing of the leg, up and down.
So we're gonna do the motion that aggravated now, and I want you to tell me how much pain from 0 to 10. So can you bend it and tell me how to?
Yeah, like right here, I'm feeling it right in here, and I'd say it's probably, the higher I go, it's probably close to a 7, up to an 8.
So that's like almost like a little bit over 90 degrees.
Yep, and I'm also feeling it in the knee a little bit, but more here than the knee.
What about squatting? Let's have you. 1 second.
Yeah, that's not as bad. I feel the pain in the same spot, but I'd say it's maybe a 3. But if I go like this, like right now, that's an 8 again. And it's again right in here today.
Oh, that's limited range of motion. That's very limited. Okay. And you get like locks, your knee locks, or?
Yeah, it doesn't really lock. It's just a stinging pain.
Stabbing. Okay.
Yeah.
And you feel it on the outside of your knee, yeah?
Occasionally on the outside, sometimes on the inside of the knee. It's more my calf and my thigh than it is my knee. It just depends on the day and what's going on.
Your thigh from the front, the side, the back?
More here, inside thigh, and right here. And the calf is very sensitive on the inside.
Inside of your calf.
Yeah.
So we'll have you line your back head over there.
Wow.
You hear that?
Yeah.
So you hear that grinding?
Yeah.
And I can see it in the tools, it's just vibrating.
Yeah, I can tell by the way you rub it.
Sorry.
That's right.
Make sure that's not painful, okay?
Yep.
Okay.
It's more sensitive than it's painful.
But you feel that...
Oh, I've got a couple knots. Feels like a knot.
That's a scar tissue, that's a knot. It should feel like nice and smooth like this.
Yeah.
Can you tell the difference?
Yeah, big difference.
Nice and smooth.
Yep.
And we get the scar tissue all in here. Sorry.
Yep, that's right.
Okay, don't kick me, okay? You promise?
Yeah.
Yeah, this is... so you will notice with this treatment that the thickness of the scar tissue and the depth should be shrinking.
Oh, okay. Makes
So
sense. Because you're rubbing it out,
like,
massaging it out.
I don't like to use the word massage because with massage you cannot really break it. You need to have heart.
Okay.
It's not easy to break it with the hand.
Got it.
And some of the tools I have, it goes deeper. You really, with your finger, you cannot go deep. Like
These things you can.
Yeah, like because it's very pointy. So you
Got it.
So you have to have like a special design things to really break it down. So what you should notice by next visit, that grinding sound decrease. Some patient actually from the first treatment we can totally get rid of it. But that's depend on how bad is the scar tissue and also their genetics. How's that?
Better.
Is it the sensitivity decreased?
Yeah, it's decreasing.
Okay. And I can feel it. It's the grinding is the sound decreasing actually.
Yeah, I noticed that too.
The sound decreasing and the vibration decrease that I feel it with the tool here, with the ASTR tool. I need to get deeper here. Is it too much here? It's okay.
No, that's okay.
How about now?
Just pressure.
Okay. Okay.
All right. Yep. Again, this is no problem at all. Oh, this is another 50% less.
So how much from 0 to 10?
Yeah, it's barely there.
Okay.
1.5.
Okay,
2.
that's good. So you have a little bit inflammation. Just use it more magnahealing. That will be fine. Yeah, you can have a seat and just you had chiropractor before. You had massage. Can you tell any difference between what you had before and ASTR treatment?
Yeah, this treatment here feels like something progress was made. That things changed. When I had my chiropractor and heat and things like that, I felt like there was some relief, but it didn't feel like it disappeared. This feels like there's a definitive difference that something's gone. There's been a major change.
That's nice. Yeah. Thank you so much. All right, Paul. So today is your 4th ASTR treatment.
Yep, correct.
So let's actually get a little brief history. Why you came for treatment? What's going on with your hip?
Well, initially I had a lot of leg pain in the thigh and in the calf in different areas. I could feel some knots. It was aggravated when I would walk upstairs, change positions, move around. Our initial session, I think I only had about a 70-some% flexion.
Oh, okay. Yeah,
you know,
yeah. You were limited with the range of motion.
Extremely.
Yeah.
Yeah.
So how long you had that issue before coming here?
Probably 10 to 12 months. You know, and it's
months,
gradually got more aggravated. My regular primary care doctor recommended I come see you.
So for the year that you had this issue, have you had any other treatment?
No.
You did not have any other treatment. So just give me an update. What did you feel after the first treatment, and how your body responded to the treatment through those 4?
Well, the initial treatment, again, we started at around 70% flexion, and we got it up to about 136 within the first session. I didn't realize the extent of the scar tissue that was in the leg. You know, through the tools that you used, I could actually hear them and feel them, and I know you did too. And for me, it was probably more of a good educational. I mean, it's one thing to come in and get relief, but for what I liked about this too was especially the educational portion of it, the importance of posture, you know, those different aspects. Yeah.
So, how do you feel now? You had 4 treatments. Do you feel you're back to normal? What do you think?
I'm getting very close to where I want to be,
okay.
And I think between the tools you've given me, the exercises, the rollers, the ball, identifying the shortness in the one leg, putting the lift in. I mean, I noticed a clear difference in I noticed a big difference immediately. But when I think about where I'm at today, walking into your office to where I was, it's like night and day.
That's beautiful, yeah. Do you have anything to say to patient or healthcare provider about ASTR treatment?
Well, I tell you, it's done wonders for me. So if you've got a healthcare provider that is looking to, figure out how to improve their practice and improve patient care, I would say this is the way to do it.
All right, awesome. Thank you so much.
All right.
Free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!